Dr. Frank Simoncini, the flow fixer from Southeast Valley Urology. A couple of schools of thought on kidney stones. So a lot of times when you have kidney stones, you may not be that symptomatic. What happens though is if you're to pass one of those stones, then it becomes a surgery. So some of the worst pain you can have out of all the diagnoses is a ureteral calculus passing. It causes a back pressure on the kidney, causes the kidney capsule to stretch. So what happens? You get severe pain. In Italy, they become, mal de panza, mal de panza. So it becomes a surgical emergency. Now, the problem with that is you go to the emergency room, and this is, I hate to say this is a typical scenario. They'll go to the emergency room, and the PA in the ER talks to the PA doctor, and the PA doctor admits it to the night hospitalist, and the night hospitalist laterals in the morning to the day hospitalist, and the day hospitalist finally gets around to see him, writes a note, and then puts a consult in for urology, and it goes to the ward clerk, and the ward clerk calls the urologist at 2 in the morning. I'm sorry, 2 the next afternoon. And then the urologist calls the operating room, and it's, oh, well, we can get you taken care of around midnight tomorrow. It's a disaster. Going to the hospital, I hate to say it, it's a mess. Yes, in the United States, it turns into a mess many times. So what's an easier way just to take care of a kidney stone? If it's too big where it's not going to pass easily, if it were to break free, we can do what's called a lithotripsy. A lithotripsy in the kidney has a 95% success rate in one treatment. So a lithotripsy is non-invasive. It does require a general anesthetic, so you don't move because we have to line up the shock wave right on the stone. That'll break the stone into sand particles and they'll just pass out in your urine. So you take a situation, maybe you're not having that much discomfort. However, you're avoiding an emergency situation, which many times turns into a disaster. Smash the like button. Come see me at Southeast Valley Urology. Dr. Frank Simoncini, the Flow Fixer. www.southeastvalleyurology.com.